then just knowing that you're not alone, right? Like this can all feel very overwhelming, and we understand completely that food is not just this, lab test we're looking at, and looking at the effect it's having on your body. It has a social meaning, it has a cultural meaning, it has emotional connection to it. So definitely want to validate that is very normal to feel. If you're feeling overwhelmed, or you're feeling like, hey, this is kind of, maybe there's a connection to food that's part of your childhood, and now you're not sure how to navigate a food allergy and this relationship with food, come to a dietitian, like Brandon said. And we might not be able to, have all the answers, right? But we can at least support you in that journey and getting you the right resources, and supporting you on that, and finding a good fit and balance, and so that you can enjoy the foods you're eating and not feel so restricted and overwhelmed.
Welcome back to another episode, everyone. Welcome to A Plate Full of Insights. If this is your first time joining us for an episode, nice to have you with us. If you've watched or listened to another episode in the past, thanks for coming back. Thanks for spending some time on a lovely day wherever you are at, whatever time of day it is, wherever you're at in the world. We're happy to have you. Brief intro. I'm one of the hosts of the podcast, the Plate Full of Insights podcast. My name's Brandon. I'm one of the dietitians at Revive Wellness. I'm here with Matthew and Roshni, also dietitians. And the reason that I have them two here with me today is we have a very relevant topic for the month that we're going to discuss, given that we got two awesome themes for the month of May here. We got Celiac Disease Awareness Month, and we got Food Allergies Awareness Month. And so we have two experts in both of these areas together. We're going to talk about the difference between the two of them, how they both differ from food intolerances. There's a lot of similarities and a lot of things on the internet and social media. You'll see people using food allergies, intolerances, sensitivities, heck, even celiac disease kind of all interchangeably. So we'll try and separate them out so that you know what's what, and then discuss what the themes are in these areas for the coming month. We'll see where the conversation takes us, as you have hopefully watched and listened before. And if you haven't, very conversational. We try and keep the vibe pretty chill here. So who wants to start? At the top of my notes, I got celiac disease at the top. So Roshni, you want to start us off going into celiac disease for us?
Absolutely. Thanks for introing that topic, Brandon. I'm super excited actually to talk about celiac today, just because May is Celiac Awareness Month. And I think it is an opportunity to open up the conversation around what is celiac, if you've never heard of it before, or if it is something you've heard of, just kind of ironing out some common questions that come up in practice about celiac. And Matthew today, I think we'll kind of chat about the intersection of other food allergies, autoimmune conditions that overlap with celiac as well. And so when we think about just a nutshell definition of celiac disease, it's really thinking about gluten. So gluten is that protein that's found in different types of grains. So things like wheat, rye, barley. There's other crossbreed grains as well that have gluten in them. But essentially, for folks with celiac disease, the body treats gluten as something it wants to attack. So celiac is an autoimmune condition. And so we have like these little finger-like projections, and they line our small intestine. And so when someone with celiac disease consumes gluten, the body sends out that autoimmune response, and we start to see damage in these finger-like projections. And that over time can affect the way our body is absorbing nutrients. And so that's where kind of we open up all of these symptoms that can come into play with celiac and affect how our overall health. So today, I guess I could kind of delve into some of those symptoms. Like, for example, for the month of May, this Celiac Association has used the phrase that celiac is a chameleon. And so it can be difficult kind of navigating all of these different symptoms because they are on a spectrum. We'll see some patients and clients that will, have some of those typical common symptoms of celiac, like gastrointestinal distress. So their stomach pains, or there's issues with the bowels. We'll have diarrhea. Fatigue is a common one. Micronutrient deficiency, because those villi are flattened up and then we're having difficulty absorbing. But other times we'll have no symptoms. And so I think maybe if it's helpful, we can kind of delve in. What do we do when we don't have the symptoms? If we're having the symptoms, is it celiac? Or like Matthew, I don't know if you want to add in here, like, even with food allergies, how those symptoms are on a spectrum.
Similarly, it can look a lot of different ways, and it's important to discuss the different ways things can present, as we will dive into here as we continue.
Great point. And one of the things you mentioned is like with like celiac, sometimes even with gluten, there's sort of a cluster of other conditions per se, or gluten related conditions. So sometimes we see in clinic, Matthew, you might have seen this too, like the um, gluten insensitivities, right? And so often that can be masked. You might have been someone that, suspects they have that and then continue to follow a gluten free diet, but then it was never formally diagnosed. And so kind of the treatment of that is a gap in our care. And so sometimes with food insensitivities, like we're talking about this chameleon, we might have all of these symptoms, but I think it's important to talk about like screening measures and knowing kind of where, if you would fall under risk for celiac, kind of bringing that up with your physician, and that health advocacy piece. So Matthew will share some great points around like food allergies and sensitivities, how to screen for those. But for celiac disease specifically, a couple things I'll just highlight is family history is a big piece. So if you have a first or second degree relative that's been diagnosed with celiac, it is part of common diagnostic criteria to kind of investigate that for you to see if you're having symptoms, to bring that up with your physician. Other things, is an autoimmune condition, like a previous autoimmune condition. Something like thyroid disease might put you at risk for celiac as well, and other autoimmune conditions as well. And then typically, if you are screened, there is an antibody that we look for. So the tissue transglutaminase is something that the doctor will screen for in your blood work. And if that marker comes up super high, along with other like inflammatory markers, um, they'll do a secondary confirmation test often. So that's the biopsy or the endoscopy that they'll do. And they'll look at those finger like projections, they'll look at the damage in your intestine and then assess if, there is damage. And if that's positive, that's when we move forward with a gluten free diet. I think this is super important to share because that's where, if we're missing this screening process and we're not going through with the confirmation of the diagnosis, we could go under the radar as like a gluten insensitivity and then miss that diagnosis. And then we'll share kind of like with the gluten-free diet, my apologies, there are some like pieces, it's where with micronutrients, we might want to be a little bit more careful about balancing the diet. So there's considerations for both, but just kind of being aware of like where your risk factors are, and always kind of working with your physician, and then working with a dietitian can be helpful in kind of making this simple, because this is a lot of information, and this chameleon of symptoms, kind of figuring out which one of those apply to you as well.
I note that there's a piece about the symptoms, and I think the part about it being a chameleon, just looking at the list here of the symptoms that could present, not all of them, of course, is that they could be symptoms related to something completely different too. Like it could be celiac disease, it could be something else. So and that's probably where a lot of the challenge for humans out there that are trying to navigate any of the symptoms that they're dealing with. If somebody's sitting across from you and they haven't been screened, they haven't done anything to pursue this as a possible diagnosis, and then of course following that treatment options. If there's some of these things going on, because I know even in the work that I do that, fatigue, digestive issues, skin issues, some like really like low key things that present. At what point do you go, man, we should probably get you to get in touch with your doctor to at least initiate the screening for it? At what point would you do that?
Yeah, that's a great question, Brandon, because it's not always the same for every person. I think that's the part that makes it tricky is kind of we have this cluster of symptoms that we know is validated in the research to be associated with celiac, but with the gluten insensitivity, the research is still ongoing. So we don't actually know the pathophysiology or like kind of what's at the root of it. Kind of when we have that umbrella term of IBS, there could be a multitude of things that are going on. But I think what I encourage, at least in my practice with clients and patients, is just to be super aware and not kind of brush anything under the rug. So if you're noticing that, hey, I'm having quite a bit of bloating and I'm having this fatigue, and I'm noticing like food journaling is a huge thing that we've talked about on previous episodes, but it's just one of those tools you can use to see like, is this an ongoing pattern or is it something that's constantly changing and inconsistent? And sometimes I look for that like chronic, because celiac disease is a chronic condition. It's something that we treat with the diet over the long term. And so if we're noticing like, hey, this is a particular food that's been a trigger for me, if I take it out of the diet, am I noticing an improvement in my symptoms? That can be something that's kind of like a green flag to then move forward to the next options for possible celiac screening. And then if that turns out negative, then there's other, it's almost like another exclusion factor. Then we have an opportunity to look at other possible conditions. Um, yeah, I think that's the way I would kind of go about it. I don't know, Matthew, if you have like a different approach with that one.
Yeah, I agree. I think the key thing really is being able to give a good history to your doctor or other healthcare providers about the progression of your symptoms, when they're going on, potential triggers you have in mind. And this can only really be done accurately through some more in depth journaling. It is a lot of work, but fortunately, it is something meant to be more temporary so that we can just get a better idea of the nature of symptoms when they happen, potential reasons why. And also considering that once you've been experiencing that for a long time, likely in a lot of distress, likely just various days and confusion, it's going to be hard to just sit there and give a detailed, accurate history without having that all really written out and tracked over time. So it's very key that we are doing that piece. And some of that can be with a dietitian along the way as you start experiencing those symptoms and working together to consider potential reasons as to a potential pattern there. One thing I'd also like to add to what Rashni was saying about the testing for celiac disease is that, and this is kind of unfortunate, but when it comes to the testing, it is more accurate if the person is still eating gluten regularly up to that test, because the antibody is still being produced in response to gluten. So there is this conundrum where even if we are fairly certain about the pattern that's continuing, for the sake of the most accurate diagnosis, it is still needed for the person to continue eating it, unfortunately. So, prolonging symptoms in the short term to hopefully have more definitive answers.
I know I've heard from somebody, a client, long time ago, uh, when we were discussing this, and this happens not necessarily in these areas, but the not necessarily self-diagnosis, but self treatment, wherein they find removing certain foods from their diet and then or adding certain ones in makes them feel much better. When I eat certain things, I feel a certain way, so I just don't consume them. And so the way you just described that, Matthew, made me think about how if you wanted to find or land on a diagnosis, you'd have to consume gluten containing foods in this case in order to provoke that response in order to actually be able to catch it, to diagnose it properly. Some people will, I can recall in my mind in some types of conversations, will go, well, I feel better already. What's the point in pursuing a diagnosis if it's not really going to change much? Now, catch there being that it could change a lot. It could open a lot of doors, but if somebody was to say something like that you're sitting in front of, what would be, because I would assume that there would be better things to come beyond what they may see in the moment of, well, why bother with a diagnosis if I already feel better? How would you handle that? Either of you, I guess.
That's a great question, Brandon, because I've had that asked so many times. And with what both of you said, is like that is like a very specific thing about celiac is like you are forced to kind of continue that diet like up to like a few weeks before you do your biopsy. So yeah, I've had patients that are like, hey, like I tried that of because they did it before they saw me. Hey, I came off of gluten and I'm feeling great. And now you're telling me to add it back. And of course, I feel, oh my goodness, I don't want to have anyone go through all of those symptoms again. But the reassurance that I have and kind of what I think is helpful to think about is with celiac, it is again an autoimmune. So any kind of, even a small particle of gluten will activate that inflammatory autoimmune response. And so the diagnosis like really helps us to understand, is it the strict gluten-free diet that we need to be on? Or is it something that we can liberate a little bit if it's a branch of like the gluten insensitivity cluster, where everyone has a different level of tolerance? I think to like when we do FODMAP diets, for example, you know, we have these FODMAP foods that could potentially trigger IBS like symptoms, but the level or threshold of tolerance is different for each individual. And so I guess working with a dietitian is kind of like helping navigate that and figuring out, hey, like this is where I feel like I can tolerate up to, even though it's like a high risk FODMAP category, or like, hey, it's like a gluten containing food, but I can have small servings of it. Or is it celiac where there's very serious long term consequences of consuming this and that damage it's having on the intestinal lining? And then, of course, with like a celiac diagnosis, there's a lot more we can do with like prevention, right? So, our micronutrient deficiencies, we know iron is a big one, or B vitamins, or vitamin D, calcium, and just making sure that, you know, we're getting enough of those nutrients that are of special concern for someone with celiac disease.
Yeah, I agree with what Roshni said there. The key thing really is that proper diagnosis is what precedes proper treatment for a condition. If we have a hunch or a high certainty, but we're not completely sure about what the issue is, we may be doing the incorrect things. And doing the incorrect things can, like in those examples Roshni gave, lead to us causing more harm in the long term. Whether it be, let's say, we think it's celiac disease, but it's not, we may be just making things much harder in our day-to-day lives than needed, and it could be more of a change in our diet and how much of something we're eating versus taking something out completely. And also, if we assume an incorrect diagnosis, in that case, we may even just miss a different diagnosis. So uh, not only are we not having celiac disease and doing something we don't need to, we may be missing a different condition that has a different cause and is causing potentially other problems. Problems that may become more obvious down the road, problems that may continue as the undiagnosed thing progresses. It's very important to correctly assess and then diagnose and then treat medical conditions rather than kind of assuming or guessing or inferring what is going on, especially with examples like this, where we do, at least in the case of celiac disease, have a more definitive process where we would know for sure. So if it is correct, we now know that we need to go forward with a completely gluten free diet. We now know that we need to be mindful of certain deficiencies. We know that we need to be more mindful of eliminating all sources of gluten and not just, for example, taking out bread. And then if it's, let's say it's diagnosed, let's say we don't have that positive diagnosis and it's something else, it could be a case like FODMAPs where we need to take out more than just gluten itself, that other things that may be contributing to symptoms, or we may be needing to take out a different category of FODMAPs, or maybe we move to a gluten-free product that has more of the FODMAPs that are a trigger. So proper diagnosis precedes proper treatment, and that's the key thing here. It's very understandable where you're very worried that I just don't want to continue causing these symptoms to myself, so I'm going to stop. I believe that this is the cause, so I just don't want to do it anymore. That's completely understandable, completely reasonable way to feel, but it can lead to, in the longer term, either missing a different condition or just not receiving proper treatment or doing things that we don't need to.
Mm, I like that. I like that. Those are excellent, excellent responses. I want to make sure we get to the section on food allergies, but before we do, you've noted multiple times throughout this piece, Roshni, about what a role that you as a dietitian, and I guess dietitians in general working in this area, could play in supporting people that may have celiac disease, may have non-celiac gluten sensitivity, or even something in this realm. Is there any other things that you can support people with in this area that you haven't already mentioned?
Yeah, that's a really, really great question as well. Um, so one that is very popular, a very popular support is the Canadian Celiac Association. And they have some chapters in Edmonton as well. And depending on where you're at when you're listening to this, you can look them up and see if there's a local chapter. And I always use that as kind of like a nice first cornerstone if you are diagnosed with celiac and you're looking for support. Canadian Celiac Association or a gluten sensitivity, they do have information on navigating that cluster, that chameleon of symptoms, and offering you support. So if it's something you're wanting to speak on to your physician about and you're looking for more information, how to advocate for your health, they have some wonderful supports along with like a symptom checklist. And I have printed that out in the past and gone through it with clients of like, these are the research evidence based symptoms of celiac. Are we having any of those? So those can be really helpful evidence based guidelines to use as a support. And they also have a gluten free one on one or 101 session. And that's really, really helpful because it is a dietitian that walks you through all of this information. It can be super overwhelming. So they offer these sessions to kind of go through label reading, understanding what are sources of gluten, navigating when you're traveling on a gluten free diet, social situations, that connection and relationship with food. So I think that would also be a really helpful support there too. Um, and then, yeah, just if you've never reached out to a dietitian before, that can also be a really great place to start. Is just have that conversation of, I've been experiencing these symptoms wherever you're at on your journey. Like, let's say if you did try out a FODMAPs diet or elimination diet of some sort, just kind of touching base with the dietitian to see if there's any gaps and if there's anything we can do on that prevention and treatment side to kind of help you out on your journey.
Very nice, very nice. Um, Insert links in places for reaching out to Roshni if you want to have a conversation about any of those things. Matthew, let's go into food allergies. So I've heard a lot of people, and I mean, this is one of the things that I noted earlier in the episode about the difference between these two is that some people, heck, I've even seen this on social media where the celiac disease and food allergies are like, for like, they're the same thing. They're both a food allergy, but it's not quite the same thing. Um, let's dig into food allergies now, um, which is I mean, I feel like even a broad category, but where shall we start? How do you want to dig into this?
I think an important place to start is by talking about the type of response that the body is producing when it comes to food allergies and how that it is different from celiac disease. So, the first thing to note is that food allergies, in the way that we normally think about it, so this is, for example, someone consumes a food, they tend to have either immediate or very soon afterwards reactions that can include things like hives, things like trouble breathing, things like tightening of the throat, just very severe, sudden reactions that in some cases can be life threatening. So these immunoglobulin E antibodies respond to proteins that are found in the food and lead to some of those reactions that I mentioned before. And as I said, these can be life threatening in some instances where people will need an EpiPen or an epinephrine autoinjector in response because otherwise it can, again, can be life threatening and have very negative outcomes. And this is different from the immunoglobulin A response that happens in celiac disease. So, broadly, immunoglobulins are antibodies that our body produces in response to things that it interacts with. There are many different kinds. Something to note as well with food allergies is that there's no specific, like, universal kind of pattern in how they go. So, again, it can range to very severe, like I said, to a little more minor. That doesn't mean that it's not serious. That doesn't mean that a more minor reaction at one point can't then maybe a different day someone has a more severe reaction. There's no universal pattern to it. So with allergies, similarly to celiac disease, so another similarity is that we do, once that allergy is confirmed, want to remove that completely from our diet for the sake of our own safety. And if it is something that is known to be severe, something that may potentially become more severe, we want to also be ready with the epinephrine auto-injector, and also having those who are around us, either those we live with and others in our family, knowing how to use them in the case of an emergency. When we want to think of the most common types of food allergies in this realm, so again, these immunoglobulin E allergies, the most common ones are going to be milk, eggs, fish, shellfish, peanuts, tree nuts. So those are nuts other than peanuts. Think of things like cashews, almonds, that kind of thing. Wheat, soy, so things like soybeans, as well as sesame. So all of these account for the vast majority of food allergies, but not all of them. People are allergic to many other things, other foods as well, but these tend to be the most common ones. And if we want, and next I can just go into diagnosis a little bit. So something to consider with the testing for these for food allergies, immunoglobulin E food allergies, is that the diagnostic process is quite different. So we start with generally we can do either a skin prick test where you may have done this yourself, or you may have seen pictures of it where someone has a lot of like pokes on their arm, and then some of them are raised, some of them are not. And our this along with a history of symptoms is what is used to diagnose food allergies. There are instances where you can have a false positive immunoglobulin E response, whether it be a skin prick test, as I mentioned, or there are also immunoglobulin E blood tests that are sometimes done. The skin prick tests tend to be more accurate than the blood tests. And then if we want real, more definitive answers there, what we would do is an allergist can then do a food challenge test for the most accurate diagnosis possible. So what we want is that positive immunoglobulin E test. We want symptoms presentation that matches a food allergy. And then to confirm things, we can then do a food challenge test in an allergist's office under medical supervision. This is not the type of thing to do yourself at home or to just try. Very important medical supervision is needed for this.
You got to it before I could ask the question. Yeah, did not,
Not a DIY.
yeah, did not a DIY. Please don't to make sure you re-listen to that, to make sure that you understand that that's something you do in an allergist office and is not at home, because that's, yeah, very, very important. Is you have a reaction and you make sure that it get treated right away. And that's, yeah. Um, good. Yeah, and I think like the most common allergens that you noted on the list here, and now there's so many other ones. And I think this goes to uh, like it's something as simple as even just a really minor reaction that can kind of like the list of uh, symptoms that we were talking about with celiac disease, although not life threatening, but the ones that are more minor get important to recognize, because the point you mentioned on how it could be minor reaction one day, it could be a severe reaction the next day. I would also imagine that it could just be a fluke where you've had just a continual string of minor reactions and you don't necessarily know when a more severe reaction is going to present. Is that a fair statement?
Yes, that is a fair statement, where it is not always the same type of reaction every time. You may be exposed to different amounts of the allergen. You may just have the same amount and have a different response. So it is important to consider that. Something else that is important is that, unfortunately, you can develop allergies at any time and at different ages. It's not always, for example, in like early childhood. They can develop at different times, but although obviously it's, yeah, different likelihoods of that happening. But yeah, they can happen at different times for the first time. They can happen at different times and different severity. And that's something that we want to keep in mind when trying to navigate this kind of thing.
So there it could be probably the most common thing. Well, in my area is going to be skewed because this is not the primary people that I work with in my work with clients. But there continues to be, and it's probably something that makes you want to gouge your eyes out every time you hear about it or see misinformation about it. But the difference between IgE testing and IgG testing, the letter E versus the letter G, and people doing IgG testing and figuring out what they're allergic to. But to my understanding, and I'll let you explain this more, but obviously they're not the same thing, but one actually looks at allergies and one is not allergies. Is that correct?
Yeah, the testing that you would do in an allergist office is going to be immunoglobulin E testing, like I said. Immunoglobulin G tests are sometimes done in other like alternative medicine clinics, and some are just sold online, more direct to consumer, direct to patient. Um, Immunoglobulin G is another antibody, and this one is more of a type of like memory kind of antigen, and it's something that helps us to build immunity to something in the long term. It is not a sign of us being allergic to that food or to that thing at this time. It's the most common antibody that's in our blood. It does help protect us against things that are harmful, like bacteria, viruses, but again, it is something that's made in memory or response to seeing something, to recognizing something in the body, building a response, and then being able to handle it in the future. So on these tests, it often just means this is either something that you have frequently, something that you had recently. It is not a sign of a true allergy to a certain food. And these tests are sometimes, in my view, marketed in a more predatory way where they're sold to someone who's maybe just very worried about certain symptoms at a certain time. They feel that they now have all the, like, we've now connected all the dots because it basically says you're allergic to everything. And then it can cause a lot of fear, confusion, and just not going down a path that is going to be helpful for managing symptoms and health in the long run.
Got it. Got it. Very helpful. I'm going to use some of these words if I ever have a client ask me about it. So the theme for the month, for Food Allergies Awareness Month, what is the theme for this month?
The theme for this month is Know It, Treat It. So it's about recognizing symptoms and being able to respond to them either in yourself or in other people. So again, recognizing those symptoms of things like hives or tightening in the throat, trouble breathing, lightheadedness, flushing, sudden dizziness or drops in blood pressure, things like that, and being able to respond to it. So things like knowing how to use those auto injectors, like I mentioned, if either yourself or someone around you has some of these allergies, and just knowing what it looks like, knowing what to do when it happens.
And I would imagine there's a bit of overlap in terms of how you work with clients and what your role is and what you help people with in this area. But uh, take us through a few of the points about what are the common things that you work on. What are some practical things that come up in your work with clients in this area with food allergies?
In so there's going to be two sides to this. So one is going to be after someone has that confirmed allergy, they've done all that testing and monitoring, maybe a food challenge test in an office. They then need to be able to live with not consuming that product anymore. And there are different pieces to this. There's being able to know which foods contain that allergen, being able to navigate things safely in terms of food labels, restaurants, social gatherings, as well as the piece of filling in those nutritional gaps that are left in the diet when we have to take it out. It's important that we recognize when we take things out of the diet, or certain foods or food groups out of the diet, we need to be more mindful of other ways that we need to get it, whether it is celiac disease, whether it is an allergy, whether it is IBS. If we're taking something out of the diet for a compelling reason, we recognize that there are drawbacks to that, and then working with a dietitian can help you with trying to fill in those gaps properly so that we're not getting nutrient deficiencies. We are still feeding ourselves, fueling ourselves. Some people feel that there's now just, I can't eat anything I had before after being told that they now have celiac disease or other allergies. And it's being able to make make it possible to still eating a balanced, wholesome, and enjoyable diet despite those challenges. And then the other piece is often unfortunately, going over immunoglobulin G tests and talking about more so giving information on next steps to discuss with a doctor or with a different healthcare provider in terms of just getting more definitive information before we then proceed ourselves. We would not be involved more in that diagnostic side of things. It's more direction once things are diagnosed, or providing that direction so that you are going in the right place to begin with.
Yeah, and I imagine if there's anybody that's watching or listening that's ever known somebody, or even you yourself have felt, man, I feel like I can't eat anything. I don't know what I can or can't eat anymore, and then your diet just becomes over time just more and more restrictive, just because you're worried about adding things in or going into certain directions, and maybe social situations become more difficult. Excellent reasons to reach out to a dietitian wherever you're at, and you can start with us, and we can lead you down a really awesome path. And if we can't work with you for whatever reason, depending on where you live, then we'll make sure you're connected with resources in your area if need be. But this is definitely something that dietitians and even us, we can help you with for sure. I always say this, and I feel like we could just keep going, but I feel like there was a lot of cool little nuggets in this episode that we went through, from symptoms to differences to how we help people to practical options, things to note when you're on this journey. Well, before we wrap up here quick, is there any last points you want to get in before we end the episode?
I think in this episode, there was, like you said, Brandon, quite a few overlaps, but kind of like take home messages. I was hearing you speak about as well, Matthew, is just know it, treat it. Like that theme for food allergies, think it could apply to celiac as well, as just really building that awareness of what symptoms am I having, and then bringing that up with a healthcare provider if you can, dietitian, if you're able to early on your journey, so that we can help assist in that proper diagnosis and get you started on the best treatment option that is best fit to help manage those symptoms. And then just knowing that you're not alone, right? Like this can all feel very overwhelming, and we understand completely that food is not just this lab test we're looking at, and looking at the effect it's having on your body. It has a social meaning, it has a cultural meaning, it has emotional connection to it. So definitely want to validate that is very normal to feel. If you're feeling overwhelmed, or you're feeling like, hey, this is kind of, maybe there's a connection to food that's part of your childhood, and now you're not sure how to navigate a food allergy and this relationship with food, come to a dietitian, like Brandon said. And we might not be able to, have all the answers, right? But we can at least support you in that journey and getting you the right resources, and supporting you on that, and finding a good fit and balance, and so that you can enjoy the foods you're eating and not feel so restricted and overwhelmed. And then, yeah, Matthew, I'm not sure if you wanted to add anything else on.
Yeah, I think that's a great place to end off on. The only thing that I have to reiterate is not doing immunoglobulin G allergy tests, because that's not a good use of your money or useful information, so please don't.
Please don't. Please save your money. Yes, yes, yes. Especially in this economy. Um, I'm sure we're going to put links to resources down below. Wherever this video ends up, we'll provide you with some of the things, point you in the right direction. For now, I'm going to say, Matthew and Roshni, thank you very much for spending some time with me, and then also us, the watchers, listeners out there. Always a blast, and I'm sure we're going to have you on again. To those watching and listening, thank you so much for spending some time with us. Hope you found this episode helpful. Please make sure to check out the previous episodes on similar topics. Please like, share, subscribe, do all the things that you may do with the podcast, so that you can make sure that you support us in even some small way at absolutely no cost. For now, hope you have an excellent rest of your day wherever you are, and we'll see you very soon.